Hello and welcome to Mayberry. Yeah, are we in Mayberry? I don't know. Let's find out. Let's find out if we're in Mayberry. Today marks the new series of Are We in Mayberry? If you guys have something you want to read on and get opinions on, you can send your letters to the email naturalshop@gmail.com, and I can read them off and we'll get opinions for you. And this is going to be a series on healthcare. Okay, so different healthcare topics. We're going to discuss this doctor's reaction and see if you've had any experiences like this and see what you think. So I just had an appointment with my doctor and she is not happy about me being on tirzepatide. She thinks I'm being scammed and says it's sketchy. I don't do video calls with the provider. I use blah, blah, blah. She even sent a message to her pharmacist and they said they haven't heard of the compounding and don't even know what the drug is. Now I find that hard to believe because tirzepatide is a GLP-1 inhibitor and it's all over the news, and they've had a shortage on it because people are going to pharmacies to get this drug to try to lose weight. However, my psychiatrist is excited for me, my therapist is excited for me, my back doctor is excited for me. My actual PCM is not, and says I'm hurting my body, that I should stop this now. She doesn't want to give me medication for nausea because she says the provider I'm getting tirzepatide from should be giving it to me. Okay. I'm kind of at a loss. I need to lose weight for the health of my back, and I'm feeling great these last 2 weeks of starting tirzepatide. I've had less pain because of the inflammation starting to go away, and I'm tolerating the side effects, and I'm excited for me. I want to do this. I'm really upset right now. So, yeah. So basically, this woman went to the doctor. She went to a compounding pharmacy to get the drug because if you were going to the regular pharmacy, it's super expensive and most people can't afford it. So if you go to compounding pharmacy, it is less expensive. And so I know why she went. And so usually your doctor cannot write you your PCM cannot write you prescriptions from compounding pharmacy. Generally, they just deal with the regular pharmacists because they are patient care managers. So they usually the PCMs are aligned with other health insurances and things like that, and health insurance will not pay for the compounding pharmacy drug typically. Anyway, so she started taking the drug and it was helping her. She went to the doctor and said, "Hey, I have nausea. Can you help me out? Give me something for a little bit of nausea," which is typical with this tirzepatide, the GLP-1 weight loss drug, because it stops your gastric emptying. It stops the gas. It slows down. That doesn't stop it. It slows down gastric emptying, so you feel full longer. But the side effect is a little bit of can be constipation and nausea. And it is recommended that sometimes they can give you something for nausea, especially if this can really happen if you eat too much while you're taking the drug. But anyway. So my issue is that I've been to the doctor before where I've needed treatment and sought out treatment, and it was kind of the opposite that happened. Like in the one particular situation that I'm going to tell you about, I went and I needed to lose weight. They recommended this drug, phentermine, and which causes palpitations. And at the time I was already having some feeling some palpitations, and later found out that was due to menopause symptoms. And but she insisted, that's what I had to do. And I had some thyroid issues, and I was telling her that I felt that the medication wasn't working, and I couldn't get her to listen to me, to really listen to me. And so my advice is for anyone out there, whether it's that you're going and you have something that you want to take, or you have something that you want to do as a health issue, or it's that the doctor's recommending that you take something, or they are recommending like a procedure or surgery or something like that, I recommend that everyone get a second or a third opinion in situations like that, especially when you feel like you're not aligned with what the doctor's telling you. Because we as patients, I know a lot of us back in the old days, maybe we got used to, our parents would tell us, oh, they went to the doctor's going to take care of it. Listen, you are your advocate. And yes, I'm not saying don't go to the doctor. I'm not saying don't listen to your doctor. What I'm saying is that be proactive in your health care with your doctor. And your doctor should be allowing you to be proactive. Like, obviously, he can't allow you to write a prescription for yourself, but he can work alongside you to help you get to the end result that you want. And if you have a doctor that is absolutely, especially if they're making you feel bad, like, I mean, this doctor was basically like, I need you to get off this now, like, don't do this. And basically what I hear from this is that, yes, the doctor is concerned, and every doctor has a right to be concerned for their patient. But what I'm hearing from this is that he's not even listening to the patient. Like, she wasn't even listening to her patient. She's just basically deciding, no, I'm against this, and so because I'm against it, you shouldn't have it. And so when you have a doctor that's not aligned with your values, you need a second opinion. If you have a doctor that's recommending surgery, you need a second opinion. Because what if you get conflicting stories?